Hello, everyone. My name is Dr. Ash Khanlesh-Carey, and I am MOASC president. Today, we are going to be spotlighting Dr. Omid Hamid and he will be providing us a little background on his areas of interest within melanoma. Dr. Hamid is Chief of Translational Research and Immuno-Oncology at the Angeles Clinic. Dr. Hamid, thank you so much for being here.
Dr. Lashkari, thanks for the opportunity to speak today in relation to breakthroughs in melanoma care.
So this is just going to be a brief conversation, but what we'd like to learn about are what are some areas of exciting advances that you're involved in the area of melanoma?
Thanks again, MOASC and Dr. Lashkari. So there's many interesting advances in melanoma care at this point that I'm interested in. I would like to begin by saying that, we've made huge breakthroughs with checkpoint inhibitors that began in melanoma and have spread to other solid tumors with multiple indications, including lung and renal and other skin cancers, endometrial cancer. So the breakthroughs in understanding newer checkpoint inhibitors like the LAG-3 targets right now, and the recent approval of Opdualag, which is a LAG-3 PD-1 combination, are interesting for me. It brings a regimen that has greater efficacy than single agent PD-1 inhibition, but less toxicity than other combinations. And I think it can serve as a great backbone for future trials. We're looking at not only singlet or doublet trials here, but triplet trials now. And we have ones with PD-1, LAG-3 inhibitors, and TIM-3 inhibitors for patients with melanoma that's been refractory to first-line therapy. I think understanding where checkpoints work and how to overcome resistance is important. Additionally, we have clinical trials with adoptive T-cell therapy, and that's where we take a patient who has a tumor that can be harvested, harvest that tumor, send it out centrally, and they remove the effector T-cells, those CD8 T-cells that kill tumor, and they grow it up to billions of cells and reinfuse it into patients with melanoma. Now, this is a paradigm that's shown efficacy in other solid tumors, including cervical cancer and lung cancer is being looked at in head and neck cancer and other solid tumors. But right now it's at the FDA for review and approval for metastatic melanoma. It's shown the highest response rates to melanoma that's refractory to initial therapy. And we have those trials available here looking to build on those breakthroughs and add something else on. So the Melanoma Awareness Month for me, as co-director of the Cutaneous Oncology Program at the Angeles Clinic and Cedars-Sinai Cancer Center, is a time to reflect on the breakthroughs, a time to push the clinical trials. And I'd say to any patient interested, they can reach out to us at the Angeles Clinic and to me directly. They can look at clinicaltrials.gov for sites near them if they're not in the LA area. What we've seen is a huge improvement in survival for our patients with metastatic melanoma, with a median survival that used to be 6 months and is now 6.5 years and is growing at each time point. We're really benefiting these patients. The science and discovery that comes from these clinical trials has the ability to translate into other solid tumors. And really over the last decade, we've made huge advances in improving our patients, not only with metastatic melanoma, but those patients with melanoma that's resected with high risk of recurrence. So clearly we're at a time of renaissance in how we take care of this tumor.
Dr. Hamid, I wanted to thank you for that wonderful explanation of some of the exciting areas within melanoma. I know that myself as a medical oncologist and other colleagues along with patients are very excited to see these advances developing. Thank you once again for being a part of this, and we'll talk to you very soon.
Thanks a lot. I appreciate it. And I really respect all the work that MOASC is doing, allowing access not only for patients, but supporting physicians as we grow and take care of the patients.
Thank you so much. Much appreciated. Good night.
Thank you.